One of the scariest times in my life was right after my child was born. New moms have a lot of anxiety. And I have a question from a concerned new mom who asks, what is considered a fever in babies, and when should parents be concerned?
Sure. Well, a fever is considered 100.4 rectally. In babies, it's really important to take the temperature rectally because that is the most accurate way of doing it. When kids become older, then you can do it orally, but certainly you don't want to be putting a thermometer into a baby's mouth. Really, when you should be concerned depends on the age of the child. Generally, less than 6 months of age, we take that fever more seriously than over 6 months of age, and there's a number of reasons that is. One of the reasons is the immune system is not quite as developed as it is in older children.
Makes sense.
Also, even though the child has had vaccines, and of course it's really important for all children to have their vaccines, the vaccines take a little while to actually take to the system, so that child is not as well protected as an older child might be. The most important thing about a fever in a baby or an older child, no matter what the age of the child, it's how the child looks as well. So if you have an older child that's 4 years old and has 100.5 fever, but they're lying there looking lethargic, not active, looking sick to you, and as a mother, you have a gut instinct, follow that instinct. If your child looks sick to you, you need to have that child seen. It doesn't matter the age of the child or the temperature.
So in an infant, lethargy can be a pretty serious signal?
Absolutely.
To what?
To sickness of some sort. So and in an infant, a young infant, if you're talking to a new mother, the infant may not need to have a fever to actually be sick as well. So, as I said before, the way the infant looks is really important, whether they're eating, whether they're peeing and pooping, whether they have any energy or interacting with you, is a really important sign.
You mentioned vaccines and the fact that their immune system hasn't quite had time yet to get going in newborn to 6 months to a year.
Right.
When are the first vaccines administered?
Depends. The vaccines that actually prevent against most of the infantile infections are first administered at 2 months. There is a hepatitis B vaccine that's administered in the hospital or at 1 month of age, but that's really not the one that protects you against most of the infant illnesses. So you have the one at 2 months, 4 months, 6 months, and those are all booster shots to actually get to close to 100% immunity.
It's been a while since mine had those vaccines.
No, of course.
So I couldn't remember. But they can, the fever isn't always indicative of...
Especially under 1 month of age. If the child doesn't look well, that is not a good sign, and you should always trust your gut about how your child looks, because you really do know your child best.
Good advice. I remember that feeling, that new mom feeling. But when is it okay to use over-the-counter fever medicines in an infant, or is it?
An over-the-counter product is okay to use probably about 2 to 3 months of age, and specifically acetaminophen. Ibuprofen we usually don't like to use until 6 months of age.
What's the difference?
Well, great question. It's actually a different drug, and it has different ways of lowering the temperature in the body. With ibuprofen, there seems to be a little bit of gastritis sometimes related to it, and with little infants' stomachs being so delicate, it's not something we really want them to be exposed to earlier than that.
Yeah, I know none of us want to upset those stomachs when they're infants, I know.